some of the cases that we had dealt with were occupational health, and specifically folks who worked with refrigerants and with solvents, freons, and as well as in some cases folks who work with fire extinguishers. Someone comes in with, who non-smoker and 35 years old and works on an airplane, and a fire extinguisher went off in the cabin, and they come in, coughing, and have their FCV1 is low, and FEC1 is low, and they're suddenly look like either an asthmatic, because they can't actually be bronchoreactive, or COPD, or you have to find out about their occupational exposures. Many folks do smoke as well, so you have to figure these things out. But sometimes there is an occupational epidemiology, whereas if you have one patient who has this, there's a possibility that the work procedures themselves, meaning the safety of the canisters, the safety of the equipment, the protective equipment, the times that they're doing these things are, problematic. And so there's a bigger implication to those kinds of cases when you find them. You have to really look at where the person comes from, and you may. Percentage of patients will not have any risk factors and won't develop COPD. Some percentage will have alpha-1 antitrypsin deficiency. Routinely, you would look for that. And then you would do an occupational health screening. And some people would be obvious. Where I work, we have many patients who come from rural parts, again, of China, where they use dung stoves. And you'll have an older woman who's never smoked. Many of the males smoke, and smoke a lot. Not all, though. And they'll have obstructive airways disease. And we've gotten CTs on these folks, and a lot of times they'll have some restrictive pulmonary fibrosis as well. So I think what you have to do is take a sophisticated, first of all, you have to do the basic medical things you would do, again, looking for things like alpha-1 antitrypsin deficiency, but you also have to take a good occupational history, and I think that's, and then if there's implications, someone's actually working with a group of other people who are doing similar things, and those cases are rare, but they do come up, I think you then have a public health role.